Vanda Mishra, we can start.
Hello, everyone. Good evening, viewers. Yeah. Suril? Suril?
Ha, Vandami, we can start. We can start.
But there is a voice in the
Yeah. I'll control it. Okay, no problem.
mute all. Yes.
Nana, you're back? Vanda Vinod Samiji.
Yes.
Still looks a bit jet lagged, but I'm.
Okay, so today we are going to discuss about meditation, pranayama, mantras, and mudras for heart health. There is no need to say about what is hypertension, but just we will see that in this particular talk we will focus on meditation, and meditation is required for mental peace and relaxation along with the awareness. Pranayam is very important for us. It is a yogic breathing techniques to regulate energy and stress. Mantras are also very important, sound vibrations used for mental focus and calmness. And mudras, you know that they are hand gestures influencing energy flow and physiological states. And there is physical exercise too, which we will see. So, and we know that this hypertension means that the force of blood pushing against your artery walls is consistently too high, making the heart work harder and increasing the risk of serious health problems. It is one of the most common cardiovascular conditions and often has no symptoms, which is why it is called a silent condition. So, how we can manage this kind of problem? So, there are some certain treatments. The first treatment is that we have to change required what we have to change our lifestyle, and in the lifestyle we have to focus on our diet, physical exercise, sodium reduction, and weight management. Medications when needed. So the doctor Devendra and Dr. Raj have already discussed about all these things, but you can see that this kind of medicines which are prescribed, especially for the heart problem. Cardiovascular burden. So we know that heart disease is the leading cause of death globally, rising prevalence due to lifestyle, stress, and metabolic disorders. And non-pharmacological interventions are gaining attention. So all these are different reasons which are putting the burden on our heart. So we will see that though Dr. Devendra has already discussed to a large extent what are the evidence for meditation for curing the heart problem, but just I have got some information so that I'm sharing. So American Heart Association, meditation may reduce blood pressure and stress. So they have done some studies and they have shown that meditation is required for reducing the blood pressure and stress. American Journal of Cardiology, meditation linked to lower cardiovascular risk, and it enhances parasympathetic activity and emotional regulation. So that's why we have to practice meditation at regular basis if we have any chance of hypertension. AIMS in Bhopal has some study on especially on breathing exercise. So pranayam reduces heart rate and stress levels. Controlled breathing improves autonomic balance and and supports cardiovascular function and mental well-being. So that's why pranayam is also very important to manage the problem of heart. Evidence for mudras. So we see that the research shows mudras reduce systolic, diastolic BP and heart rate. It also reduces blood viscosity and improves blood circulation. And effective mudras are also very effective in managing hypertension and stress-related cardiac issues. So, what is the mechanism of action in yoga practices? So here we can see that autonomic regulation via vagus nerve stimulation, improved vocal tone and heart rate variability, enhanced endothelial function, and reduced inflammation and stress hormone modulation. For example, cortisol reduction. So these types of functions are studied, especially related to the yoga practices for heart. So meditation techniques. So what kind of meditation we have to do? So most of the reasons we find, mostly the reason is that we have so much stress and um, our mind is not very much concentrated. So first we have to practice mindfulness. And in this meditation is a kind of a non-judgmental awareness of present moment, when we live more and more in the present moment and avoid the past incidents which are harmful or which were not in favor or may cause some kind of tension in us. So we have to avoid those kinds of past events or past incidents or experiences, and also those things which are causing any kind of anxiety or worries in us regarding the future plans. We have to avoid that things also. So mindfulness means that how we can be more and more in the present rather than in the past and in the future. Breath awareness. In this particular practice, we have to focus on our natural breathing rhythm. Those people have got heart surgery already, they need not to give any kind of pressure to their heart. Just they have to be aware of their normal breathing rate, how it can be under control. It means it should not be very much shallow. At least it should be under the rate which is 15 to 17 per minute according to the medical science. But yes, if we can reduce that number also, then we can get more oxygen, more deep and long breath. So our mind can be more calm and cool, and our heart can also be energetic. Perception of long and deep breath. So that's why if somebody has got some such kind of heart surgery or any treatment, so he can just practice 10 to 12 long and deep breath. So it will help to strengthen the lungs and thereby to take more and more oxygen from outside, which help power all the body, including the heart. Meditation on lungs and arteries to be healthy. So it is very important that if we meditate on lungs and arteries, which are involved in this particular problem, so just how we can keep our lungs more healthy, more strong, capable to take more and more oxygen or storing more and more oxygen inside. So if that can be done, that will help us in this particular problem. And arteries which are having some kind of plaques in them or blockages, so we have to meditate on that also. For that, especially the breathing exercise is very important. But if it is somebody is quite healthy and has no heart problem or no any kind of such kind of heart attack, etc., so they can practice breathing exercise at regular basis, so that they should not have any such kind of heart problem in future. Guided relaxation. So audio led body and mind relaxation. So yes, we have already practiced so many times relaxation, full relaxation, short time relaxations, and I have also shared the audios, how you can listen to audios and can practice relaxation for longer period, at least for 45 minutes. So it is necessary that our mind and our body should be under relaxed state. It should not be so much hyper. And for that, we have to practice at least relaxation for 45 minutes. If we have not that much time, at least 15 to 30 minutes, we have to practice. We have to do relaxation so that it would control our hyper state of mind and body. Now, the pranayam, the breathing exercise, which breathing exercise can be more useful and helpful in this particular problem. So we see that Anulom Vilom pranayam, that is the alternative nostril breathing, and it is important for balancing the energy inside the body and also the flow of the blood in the arteries and nerves and veins. So Anulom Vilom Pranayam is good if there is any kind of blockages in any side. It can be cleared by this particular breathing exercise. It can be done with some speed so that it can cleanse the arteries, the veins, and also if the lungs has some kind of a contamination, air contamination or any such kind of things, that can be cleared by this pranayam especially. Nadi Shodhan pranayam or any pranayam, all will help to clear the blockages or contamination. So this pranayam can be done. Bhramari pranayam, that is the humming bee breath for calming the mind. So we know that putting a thumb in the ears and the index finger on the eyes, middle fingers on the nose, and two little fingers on the mouth, we can do this kind of humming sound. That is the Bhramari pranayam, and that will help us to calm down our mind. Ujjayi pranayam, it is known as arsenic breath to enhance oxygenation and calmness. So this Ujjayi pranayam is also very good. Just we have to make our throat muscles a little bit harden, so that when and take breath. Though we are taking a breath through nose, but we are using the throat muscles to take breath and also breathing in and out. So making the sound like the ocean. So that Ujjayi pranayam will also help us in strengthening our heart. There are certain mantras which we can practice, and so repetition of sacred sounds calms the nervous system, and especially Acharya Mahapragya ji referred to Rim mantra for the heart, especially. So Rim mantra, if we can chant Rim, 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 Rim like this, so that will give what we say exercise to our heart, and the vibration goes to heart, and we can feel the vibrations of the Rim mantra on our heart, and thinking that our heart is getting cured and completely healthy. Sound vibrations influence the brain wave patterns, and it also promotes parasympathetic dominance and emotional balance. So that is very much required, especially for those people who are having such kind of heart problem or hypertension. Now you would see that there are certain mudras which we can also practice for strengthening our heart. and arteries or lungs, etc. So here the Hriday Mudra, which is you can see here, the little finger is straight and the index finger is in the root or at the base of the thumb, and two middle fingers and the tips of the two middle fingers touch the tip of the thumb. So it is a kind of a Apan Vayu Mudra. So we know very well. So this is also called the Hriday Mudra. It supports heart function and makes emotional balance. Apan Vayu Mudra. So the same mudra is known as Hriday Mudra, and the same mudra you can say Apan Vayu Mudra. So emergency mudra for heart attack support. So it is said that whenever somebody gets a heart attack, immediately if he starts this kind of mudra, then he can easily reach out the hospital and can get support, medical support. So for immediate control, if we can practice this kind of mudra, then it can help us in critical condition or for immediate support. Ganesh Mudra, so it opens the heart chakra and relieves tension. So here you are perceiving that how this Ganesh Mudra is done. The fingers of the what we say right hand are being locked or connected, what we say chained with the fingers of the left hand. So this is this is giving some little bit pressure inside, and if this mudra is done, that can also help. So here it is said that practicing Ganesh mudra helps in increasing the metabolism rate, which helps in reducing weight. Ganesh mudra reduces block tension in the shoulders, which is useful in recovering from depression, alleviation, and debilitating and debilitating and heart problem, and removing cholesterol blockages. So you can see that it is also useful for heart. There are certain physical exercise which we can do and which can also help us in the condition for making our heart more healthy. So Hriday Stambhasan. So I have tried to see the picture for that particular what you say exercise, but I could not find out. But just I will see that if it is available, I will post it. Yoga Mudra, and that can also help us to strengthen our heart or to calm down our heart. Pavan Muktasan, which we know already how it is done. So Pavan Muktasan can also help us to strengthen our heart. Viparit Karni, this is also very good for heart, and yogic exercise which are related to heart. We can practice those physical exercise too. So there are some clinical integration. So as Dr. Devendra says oftenly that we are just suggesting some complementary or you can say supplementary alternative therapies as in the form of different Praksha Yoga and Praksha meditation. But the patient can talk about his problem with his doctor to his doctor, how the clinical integration can be parallel or can be used can be made with the yogic practices for the heart problem. So recommend as an adjunct to conventional therapy. We have to just say that this is the conventional therapy. Whatever conventional therapy is given to the heart patients, that can continue if he wants to continue. But we can also suggest our yogic practices to them. Encourage supervised practice with trained instructors. So it is also necessary those people who are having some heart problems, they have to practice any physical exercise or breathing exercise under the supervision of some yoga instructor. educate patients on safe and consistent practices. So it is necessary that when whatever we are teaching, we have to educate our patients that how they can be consistent and safe in practicing the yoga. Contraindications, those people who are having some heart problem, severe heart problems, so they have to be very much careful before doing any physical exercise or breathing exercise. So avoid intense breath retention in severe cardiac conditions. And monitor patients with apneas or unstable angina. So it is also necessary or individualized practices based on patient tolerance. So we have to suggest all the yogic practices according to the tolerance power or capacity and also the requirement of the patients. So these are the references which are just we can see that how American Heart Association has done some study on meditation and heart health. American Journal of Cardiology, they have also done some studies on meditation and cardiovascular risk. AIMS Bhopal Journal of Ayurveda and Integrated Medical Sciences, they have, and it is yoga. So Mudras for heart health. So they have done this kind of a study, and there is a one organization in Delhi, which is known as Adhyatma Sadhana Kendra, especially Praksha meditation is done there. So some pilot study on heart problem was also done by that institution, yoga institution of Praksha meditation. And they have also found that these different techniques of meditation are working, and the patients are getting cured without. Sometimes some patients they were suggested for some surgery, heart surgery, but before going to the treatment, they have started this yoga practices, and they need not to go to the heart surgery, so they could avoid even the heart surgeries, which was prescribed by the doctors, just by practicing regular yoga and meditation and mudras and physical exercise. So in this way, we find that several studies have been done, especially on the hypertension and yoga practices. And we have seen that these yogic practices are also very helpful in managing the heart problems. Okay, so if we want to practice meditation and mantras, especially for heart problem, then we have some time for practicing that one, that thing. But before, if somebody has any question, they can ask. In pranayam, we have already discussed so many times that Chandravedi pranayam is very important for high blood pressure patients. And in daytime, it is normally suggested that our left nostril should work. The breathing should come through that nostril more and more. So that will also help us to control our heart problems, and it is good for managing the heat inside the body. So, any question?
Nami Naman Sami Samniji.
Hmm.
So, Anulom Vilom Samniji. We should practice the fast version of Anulom Vilom, the
Yes.
alternate breathing.
Those people who have no heart problems or have not got any kind of heart surgery, they can practice the fast one.
Mhm.
That will be better for them to avoid any such heart problems in future. Yeah. But those who have got already the surgery, they have to be careful and they should consult with their doctors before practicing anything.
Before practicing anything. Even
Yes, yeah, there's the
normal.
slow
They can do
breathing.
the normal. Yeah,
Yeah,
no,
normal can be done by anyone,
right.
whether they got surgery or not.
Yeah.
But yes, for fast, we have to be careful of.
Right.
Yes. There is one book which is written by Acharya Sri Mahapragya ji, and its name is Bhitar Ka Roog, Bhitar Ka Ilaj. Clear? So this book is talking about the heart problem and also the solution through yoga and all the exercise and meditation and mantras which are prescribed to control the high blood pressure or low blood pressure, including all those practices, we can include all these particular yoga practices which I have referred today. So that so it would be too much. So I did not mention all those things. Sure. What we say, lungs problem, etc. But they are also given in the book. So just we have to see that what kind of patient is coming to us, what kind of problem he has. So according to that, we have to suggest the yoga practices. Okay, so there are so many practices. Everybody cannot do that much.
Right.
Okay, so we have to see that which one, what is the main problem, what is the main cause of a heart problem. Then we have to suggest according to that. If he has lungs problem, if he has a blood pressure problem, if he has some other problems, arteries problem, then we have to suggest the yoga according to that. Any other?
Undami, heart issues generally start with like high cholesterol.
Okay.
So that is mainly like plaque in the arteries.
Correct.
So the Nadi Shodhan would be the best thing for like, you know, for reducing the cholesterol, I think.
Yeah, so Nadi Shodhan and Anulom Vilom Pranayam.
Anulom Vilom.
Yeah, so both can help us. Yeah, and I say that all the pranayams, they will all will help, especially they are pranayam are especially connected with the nerves. Okay, whether they are arteries or veins or any kind of nerves or energy paths. So all the pranayams are useful, but just we are mentioning one or two, looking at the problem.
So when you say Chandra Bhedi, that we just breathe from the left side continuously for a few like breaths, like 10 to 12 times only on the left side.
That is for long and deep breath. But I told that if somebody has the high blood pressure problem, sometimes it is because of some genetic reason or some other reasons. If we have or if we are engaged too much in some or other activities, and we may be very much hyper from inside, and that's why the blood pressure is high. So how you can calm down your mind and your body? So for that, the left nostril is useful. You have to breathe in through that and breathe out through that. So it will activate your parasympathetic nervous system, and you would not be so hyper because of that. The whole body system is getting activated hyper. activated, and for that the blood pressure would also be high. Any other? Dr.
Just,
Devendra?
just for Sheetal, I was saying that we didn't cover it just because it's a lot to cover, but for hyperlipidemia, all those pranayams work. So we mentioned that each one has good data on, like the Anulom Vilom has, Kapalbhati has, Bhastrika has, and rhythmic breathing. They all have independent of together data showing that they lower your cholesterol and increase your healthy cholesterol. So you're right, they would be useful for that.
Rim mantra. So we will practice Rim mantra for the time being. I don't know if this Zoom will help us for reaching out to you, and the sound especially because it breaks down when we recite mantras or any kind of musical things. So Rim mantra is especially for heart. Sometimes the mantras are helpful for us, sometimes the physical exercise, sometimes the breathing exercise, sometimes the mudras. So we have seen that at once if we want some treatment, then Apanvayu mudra is good for the person who has got some kind of a heart attack and he need immediate treatment for that. But for reaching out the doctor and hospital, he needs some support before. So he can practice that kind of Apanvayu mudra. Okay. So just we have to see that when what kind of yogic practice help us. We have to be careful and we have to be conscious of that. So Rim mantra is very good. So we will sit in comfortable posture and recite Rim mantra for 5 minutes, and you have to feel the vibration of Rim mantra at heart. Okay, so be what you say, relaxed first of all. Sit in comfortable posture, keeping the backbone and neck straight. Both the hands are in the posture of knowledge on the knees, facing upward the sky. Close your eyes softly. Relax your body, mind, and vocal cords. Now we'll recite Rim mantra. When we recite Rim mantra, we have to feel the vibrations of the mantra on heart, thinking that our heart is getting strengthened. It is working in a proper way. The arteries are becoming clear, or you can see the blood flow is normal in the arteries. So in this way, you have to think about your heart, health of heart. when you are reciting this mantra. Rim, 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 rim. Now recite the mantra at mental level without uttering and visualize the mantra written on the heart. Now you have to visualize the mantra in bright orange color, spreading the rays of the rising sun on the heart, around the heart. Open the eyes. So this is a Rim mantra. When we utter the mantra, we feel the vibration on that particular organ. And now the meditation we can do, and that is the normal breathing perception. So that can also be done to calm down our mind and also our heart rate. So this is what meditation which we have to practice. Relaxation is already there. So that is the part of our meditation. So we'll do both the meditation today. So sit in comfortable posture. Close your eyes softly. With 5 Om sounds, we will start our meditation. Om is also for calming down our mind. Om. 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 Relax. Relax your entire body, mind, and vocal cords. Make a resolution. I am practicing Praksha meditation for the purification of my psyche. I am practicing Praksha meditation for the purification of my psyche. I am practicing Praksha meditation for the purification of my psyche. The first step of meditation is relaxation with full awareness. Concentrate your mind on the big toe of your right leg, right foot. See the toe from inside. Each and every cell, tissues, nerves, muscles, their functions. pure perception. Be a neutral observer. Give suggestion to be relaxed. Relax. Relax. Experience that the toe is getting relaxed. Now allow your mind to spread throughout the right foot. Suggest to the each of the cells, tissues, muscles, and nerves of the right foot to relax. Toe to hip joints. See each and every part, giving suggestion to be relaxed. Feel complete relaxation in the right foot. Now concentrate on the big toe of the left leg foot. Starting from the toe to hip joints, see each and every part, giving suggestion to be relaxed. Now attain complete relaxation in the left foot. Now concentrate on the lower abdomen and the upper abdomen. Going up to the ribs, chest muscles, collarbone, up to the neck muscles. Be completely aware from within, fully concentrated. Give suggestion to each of the organs to be completely relaxed. Relax both the limbs from palms to the shoulders. Concentrate on both the hands. Give suggestion to be completely relaxed. Finally, relax the head from neck to skull, throat, chin, jaws, lips, mouth, cheeks, and all other facial muscles, nose, ears, eyes, temples, forehead, and skull. See each and every part. Giving suggestion to be relaxed, relaxed. Experience complete relaxation in the whole body. Simultaneously experience keen awareness of your own self, distinctly apart from the body, and maintain the awareness. Besides being a pre-meditation exercise, Kaiosarga is an excellent remedy for hypertension and a direct antidote to other psychosomatic diseases resulting from stress. Now, the next step of meditation is perception of breathing. Concentrate your mind on the tip of your nose and watch each and every inhalation and exhalation normally going on. Each and every breath. Regulate your breathing. Make it slow, deep, and rhythmic. Use your abdominal muscles when you inhale. continuing the slow, deep, and rhythmic breathing, shift your attention on inside the nostril at the junction where the two nostrils meet. Let the perception of breathing fill your entire mind and relax your heart. Be fully aware of each and every breath. Fix your consciousness totally on the process of respiration so that each and every inhalation and exhalation is perceived. Maintain the continuity of awareness throughout the session. Meditation and yoga affects when you are fully aware from within. Take slow, deep, and rhythmic breathing. And be concentrated on the breathing process. Now, with 2 long breaths, we will conclude our meditation, making 2 sounds. Conclude meditation. Om. Om. Rub both the hands and keep them on the eyes. Open the eyes. Okay. So, Thank you very much.
Vandam Namo Samani. Kutagisi.
Tomorrow is Ramesh Parmar. He will teach all this physical exercise. And day after tomorrow, Saturday and Sunday, we have 4 hours in-person classes at the center.
That's this weekend, Vandami. It's
Yes.
I think that's the following one, Swamiji. This
Huh?
weekend is still